Idiopathic pulmonary fibrosis, IPF, is a chronic, progressive, fibrosing interstitial pneumonia of unknown cause. IPF is one of the many different types of interstitial lung diseases, or ILDs. Although it is a rare disease, recent data have suggested that the incidence and prevalence of this condition have been increasing over time. IPF is a serious and deadly disease with an estimated survival of only 2 to 5 years. Thus, this condition needs early recognition and intervention. These patients may present to your practice with a dry hacking cough, shortness of breath, or Velcro crackle sounds in the lower lung. Symptoms may be mild or even absent early on. As the lungs develop more scar tissue, symptoms worsen. You, as a frontline provider, are a key player in the early and accurate recognition of this disease. Timely interventions are essential to ensure that these patients receive proper treatment to best mitigate disease progression. Of concern, there continues to be a diagnostic delay, about 2.1 years, among patients with IPF. 1 in 4 patients with this disease also have a delay in diagnosis of more than 5 years. One survey also showed that 75% of patients with IPF consulted at least 3 physicians prior to receiving their diagnosis. Problematically, this condition is often misdiagnosed for other respiratory conditions, such as sarcoidosis, COPD, and scleroderma. Common hurdles that can lead to misdiagnosis and delayed diagnosis of IPF include lack of familiarity with the disease, repeated, often unnecessary and expensive tests, and seeing multiple providers. Some common risk factors for IPF include age over 60 years, male gender, cigarette smoking, acid reflux, work-related exposure to metal or wood dust, and genetics. How should one differentiate this disease from other ILDs? Patients with suspected IPF include those with unexplained symptomatic or asymptomatic bilateral inspiratory crackles, an early sign of lung fibrosis, and being 60 years or older. Patients with suspected IPF, unexplained dyspnea on exertion, and/or cough with evidence of ILD should be carefully evaluated for potential and/or identifiable causes of ILD. These include domestic and occupational environmental exposures, connective tissue disease, or drug toxicity. If a specific diagnosis is not made or no potential cause for ILD is found, further evaluation is influenced by the patterns of HRCT images of the chest and supportive clinical findings from multidisciplinary discussion with the radiologist, pulmonologist, etc., to confirm or exclude the diagnosis of IPF. Referral and coordination with an ILD center is also key to ensure an accurate, timely diagnosis and care for your patients with IPF. Rapid IPF care interventions positively impact disease progression, quality of life, and emotional well-being. Please refer your patients with suspected IPF to the Pulmonary Fibrosis Foundation. While not all patients may be close to an ILD center, these centers are still able to connect your patients to an experienced clinician in their community. As a PCP, you can help manage the adverse events of and answer questions about the currently approved pharmacotherapies for this condition, the TKI nintedanib and the pyridone pirfenidone. Common side effects for both agents include diarrhea, nausea, abdominal pain, vomiting, headache, and weight decrease. You can help your patients on these therapies manage their side effects and maintain their treatment. It's important for PCPs to work with ILD specialists to help patients with IPF receive these options as soon as possible for the best potential outcomes. PCPs need to forge a partnership using shared decision-making, also known as SDM, with their patients to help maximize their quality of life. It is of particular importance for clinicians to monitor these patients' mental health. It's common for patients with IPF to experience depression and anxiety, or just feel general stress. All in all, PCPs are key members of the interdisciplinary team. Surveys of patients with IPF have revealed much frustration as well as a disconnect with their providers. It's crucial that all frontline providers are properly informed to ensure that these patients receive timely diagnoses and proper care. You might be seeing more patients with pulmonary fibrosis than you realize. Luckily, the available diagnostic tests are easily accessible.